Good evening, everybody. I'm so excited to be with you here this evening. Thank you for joining me. Tonight, we are going to be talking about 7 key areas of life, and I'm going to incorporate some different ways to be healthy within that. And so I want to just introduce you to myself. So I'm Dr. Melissa Balizan, medicine woman, and I have over 52,000 clinical hours. I have been involved with Eastern and Western medicine, and I've helped thousands and thousands of patients to optimize their health, reducing the number of medications and number of supplements that they take. And I am here to walk alongside you on your health journey, to assist you in staying healthy, being healthier, getting rid of those medications. Because on Dr. Melissa Medicine Woman, we ask, is it time to ditch those pills? To get rid of them. You are not destined to be on pills for the rest of your life. And so before we do get into the content tonight, I just want to let you know, I do have a disclaimer that this show and all the content are for educational purposes only, not intended to diagnose, treat, cure, or prevent any disease or psychological disorder. A specific physician-patient or pharmacist-patient relationship is necessary before medical therapies are initiated. And please consult your physician, pharmacist, or other qualified healthcare provider with questions about your medical conditions and before starting or using any dietary supplement, herbal remedy, or exercise or nutrition plans. And so, as I said earlier, I'm Dr. Melissa. I am your pharmacist. I'm your consultant pharmacist because I help you with your medications. I am the medication expert. Your physician or nurse practitioner or PA on average had only 600 hours of pharmaceutical knowledge in school. That's about one semester. And I had 6 years of pharmaceutical knowledge. And so I definitely am a medication expert. I have educated myself on supplementation as well. There are supplements that interact with your medications. There are supplements that interact with your other supplements, even if you're not taking medications. So just want to let you know that. Now let's get into tonight. So I'm a wife. I've been a wife for 21 years, and I don't have children, but I do have a little doggy. We have a new puppy. And so life gets busy and time, we're training her, we're working, we're doing our things. And sometimes we get busy and things get in the way. And so tonight I want to talk about 7 key areas of life that we need to put these big rocks or big oranges in our basket first. Okay. So these 7 key areas are faith, family, fun, fitness, field, finance, and friends. And so let's talk about them a little bit. So faith, having faith in a higher power, having faith in yourself. Faith is huge. You need to find a way to be sustainable and have faith. Is that reading something? Is that praying? Is that meditating? Whatever it is to help you with your faith. Put that in your calendar first. That's one of your big rocks. Family. Family is essential. Make time for your family, whether that's your spouse, your kids, your parents. Take time to be with your family. Put them in your calendar. Spend family time together. Is that once a week? Is that more often? Is that once a month? Are you calling your parents? Are you have elderly parents? Put it in your calendar to call your parents. Spend time with your significant other. Have a date night. Fun. That could be your date night. That could be going bowling. That could be going for a hike. Do something fun in your life and build it into your calendar on a regular basis. This is another big rock. Fun is essential. We are not destined to be robots, to just move through the motions of life. We are meant to have fun. And we have to have a balance between all of these. So sometimes our wheel is not going to be completely round. It's going to be obscure for a while. But We want to try and be able to get that so that we're riding on that balance wheel. And when one area of your life is out of whack, it's tough in your other areas. And so if you can incorporate a little bit more fun in your life, then you can get right back on track and get on balance. Fitness. Now, fitness just doesn't mean the physical fitness. It also means, as we talk about whole body health, it talks about your health, fitness and health. So these are all F letters. So they all start with F. And health, of course, didn't start with an F. So we put fitness. Now, fitness does mean your health. That means your movement, your nutrition, your mental, your physical, your emotional, and your spiritual health. All of these things. And we're going to talk about 20 different things that you can do to be and stay healthier. And we're going to talk about them. We've talked about many of them in the past, but what you're eating, how you're moving, functional movement. We've talked about that. We've talked about Mediterranean lifestyle, Mediterranean nutrition, Mediterranean diet. That is one of the best recommendations I can give you for a diet plan to follow. Field. Now, this is your field of expertise. So your field of expertise, like mine, is a pharmacist. And so my knowledge of pharmaceuticals, of the body, of supplements helps you and me to make sure that the medications that you're taking are not interacting with other medications when we do a consult, to make sure the supplements that you're taking are good quality supplements. You're not throwing your money away by just taking a supplement off the shelf of that big box store. So be sure that you're getting what is necessary. Are the supplements you're taking necessary for you? Have you done some lab work? Let's talk about that. What is your field of expertise? This is your career, your job, something that you're doing that you spend a great majority of your time doing. We spend hours and hours at work, and we should enjoy our field of expertise. Finance. Finance is a huge stressor for so many people. This is another big rock we need to put in our bucket first, put in our calendar first. How are you handling your finances? Are you hiding under a rock, not wanting to pay your bills? Are you jumping for joy because you have so much money? What is your perfect financial situation? What do you want it to look like? Have a budget. Stick to your budget. Whether you're on the upper end or the lower end of the financial spectrum, being in control of your finances is a key, huge part to reducing and relieving stress. So have that budget, stick with it. And then friends. Friends, you need people to talk to. You need people outside of your home, outside of your spouse. Somebody to talk to, somebody to go and hang out with, somebody to go for a walk, somebody to go to yoga class with, somebody to talk to, somebody to swap recipes with, whatever it happens to be. Have friends in your circle. Put them in your calendar. That's another big rock. Make time for your friends. Is it once a month that you have a girls' night? That you go and enjoy a movie? Whatever it is. So as you notice, some of these could overlap. Fun and friends could go together. Family and friends to go together. Family and faith could go together. Faith and friends. Some of these can overlap. But just remember that you're putting these 7 key areas in your calendar first. Let them fill up, and then the pebbles, the little rocks, will fill in around them. These little things that I remember at one of the places I used to work, that I would call somebody and she's like, I'm putting out a fire. I'm putting out a fire. Well, these fires are those little pebbles and those little rocks. And yes, they sometimes need to be put out, but don't let them overtake you. And that's what she did. Is she let them overtake her, and things went south for her. Her health started declining. And when she turned it around and put those big rocks back in first, she was still able to take care of those fires, but she was able to take care of herself. So put the big rocks in first into your calendar. Make time to do these things. Now let's talk about, this is a list of 20 different items, and we've talked about some of them before, but 20 different items that are ways to be healthy and stay healthy. So eating a healthy diet. So we've talked about this in the past. What does that mean? Eating a healthy diet. Well, a healthy diet is a variety. Now, I do like the Mediterranean diet if you're going to be considered a diet. Now, whatever you're eating, that is your diet. So your nutrition plan. So when you're eating foods, you want to have a variety of foods. So the more colorful you can make your plate, the better it is, because you're getting so many different nutrients from those different colors of vegetables and fruits. Nuts, whole grains, fruits, vegetables, those are all very key things. Healthy fats. You need a little bit of fat in your diet, but they need to be that healthy kind. Now, if you need to watch certain things, if you're trying to lose weight or you're trying to gain weight, then we'll talk about your macros and how much you need and how much you don't need. And we can work through that. I have a program right now that I'm starting on, a monthly program that we're kicking off these 7 key areas, and we're going through and we're setting our goals for each of these areas. And then we're picking our one thing that we're working on. Our one thing, is it for you to lose weight? Is it for you to fit into that bikini this summer or next summer, or whatever it is, to be healthier? So these are 7 key areas, and all of these healthy tips that we're talking about fall within one of those. Now, overall, to be healthy, we want to consume less sugar and less salt. So salt can increase the amount of fluid that you're retaining, which is not good because that makes your heart work harder, makes your kidneys work harder. Salt can also increase your blood pressure. So there's a fine line with the amount of salt. There's so much sodium in things that we consume today. Sodium is a preservative. And so all of these canned foods that you buy, even if you're buying canned vegetables, most of them have sodium. A lot of these days now actually say no salt. But what that does is a preservative. And so if you're buying food that has sodium in it, you need to, I would recommend that you bring it home and you rinse it. So you open the can and you rinse the vegetables before you cook them. And that's going to take off a lot of the sodium if you can't buy sodium free. If you're buying fresh and you're buying frozen, then the chances of sodium are low. But read those labels and find out how much sodium is in what you're eating, how much sugar is in what you're eating. Sugar is a very addictive substance. Now, sugar can make things taste yummy, but sugar can also feed your body in the wrong way. Sugar, there's limitations on it. So pay attention to how much sugar you're consuming. You want to consume less. Read those labels, because there's so many different ways that sugar is represented these days, fructose and corn syrup and maltose, and you want to make sure that you're not getting as much sugar. Also, fats. So we talked about healthy fats. Now, there's bad fats as well. So let's talk about healthy fats. So healthy fats found in fish, avocado, nuts, sunflower, olive oil, canola oil. Those are good, healthy fats. But if you want to read your labels and you want to avoid fats that are polysaturated fats or unsaturated fats, those are bad fats. Okay, so you want to avoid those. Now, of course, we want to avoid excess alcohol. Alcohol mixes with medication, not in a good way. Alcohol mixes with supplements, not in a good way. Alcohol can impair you. So definitely no driving while drinking. But if you have specific health concerns or health problems, then reducing the amount of alcohol you're drinking can be beneficial. Now, there are some studies that show that a glass of wine has good, healthy tannins in it, and it can be antioxidants. So they're antioxidants, and they're healthy. They're good for your heart. So that is up for, let's put that up for interpretation. Okay, so if we want to talk more about that specifically, then let's have a chat. There are pros and cons to alcohol, but I want you to avoid the amount of alcohol. There's no specific safe level. I've had clients ask me, well, how much can I have? We look at their medications, we look at their lifestyle, we look at their history, and I come up with a recommendation. So it's not necessarily that you can't have any on certain things, but sometimes it's better to not have as much, and sometimes it's better to not have any. Okay, now let's talk about your lungs and smoking. So smoking, of course, is not ideal for you. Smoking can impair your lungs, can cause where you are not going to breathe as well. It can cause you to not be able to smell or taste as well. Studies have shown that those who have smoked for 20 plus years, once they decide to quit, and there's various stages, so it doesn't have to be 20, you could be smoking for a year or more, but if you've been smoking for 20 years or more, there is still hope. You can quit, and you will notice a change. You will notice you can smell things differently. You can taste things differently, because the smoking blocks your senses along with filling up your lungs. So ideally, don't smoke. Activity. We talked about fitness, and we've talked about in the past about physical fitness, functional movement. We need to move our bodies. We need to do stretching for our bodies. We need to do calisthenics for our bodies. So we're moving and we're expanding and we're contracting those muscles. We need to do this on a regular basis. And because what happens is if you don't move your body on a regular basis, it's not going to move as well the next time you want it to move. You ever notice that you go out and you decide to pull weeds, and you come in the next day and your legs are sore and your back is sore and your arms are sore? Well, because you're moving your body in a way that probably hasn't been moved before. Now, did you do some stretching before you pulled those weeds? Are you doing actively walking before you go out and do that? You're using these different muscles when you are pulling those weeds. So stay active, move those muscles, do the calisthenics, do the isometric exercises, so that when you go from day to day, you have the functional movement. And when you need to go out and pull weeds, you're not as sore the next day. Now, if you have high blood pressure issues, so you've been diagnosed with high blood pressure, or you're on a medication that's causing your high blood pressure. High blood pressure is known as the silent killer. And that is because there's no symptoms. You don't feel it. Now, low blood pressure, sometimes you'll feel lightheaded, dizzy, faint, sometimes. But high blood pressure, for the most part, there are no symptoms. But high blood pressure can attack your kidneys, it can attack your heart, and it can lead to even other diseases if not controlled. And so routinely, I recommend that you check your blood pressure. Now, if you're checking your blood pressure, getting your annual physical with your physician or your healthcare provider. Go in when you're in the grocery store next and check your blood pressure. At the wellness center, check your blood pressure. Periodically check your blood pressure if you don't have high blood pressure. If you do have high blood pressure, you need to routinely check your blood pressure and make sure that your medication or your lifestyle changes are working for you, and we're not putting you at risk of developing a heart attack or stroke. So take your blood pressure routinely if you do have high blood pressure, and at least periodically, just to check and see where you're at. Okay. Now, of course, ways to stay healthy. So if you are at risk of being infected with an STD, or hepatitis, HIV, then I recommend that you get tested. Check that out. We want to make sure that you're healthy. And so if you have been exposed or you're at risk, be sure you get tested for that. Now, vaccinations. Vaccinations, I know, are a big controversy right now. But if we think back, vaccinations have prevented disease for years and years and years. And there's vaccinations that come out all the time that have helped to protect us against hepatitis B, the flu, measles, mumps, pneumonia. There's a vaccine for chickenpox now, rabies, tetanus, yellow fever, typhoid. So there's many vaccines out there, and the COVID vaccine is new as well. Now you've got to do what is best for you. But if you decide that you need to be vaccinated, then I highly recommend you get vaccinated. Vaccines have proven to save lives, especially with hepatitis B, measles, mumps, all of these things, typhoid. So just keep that in mind and vaccinate. Now, of course, we talked a little bit about STDs if you're at risk for that. So let's talk about practicing safe sex. So yes, one thing to do to be healthy is to practice safe sex. Now, are you in a monogamous relationship? That's one way to practice safe sex. If you're trying to control other things from happening, then there's ways to do that. But if you are out and you don't have you're not in a monogamous relationship, then please make sure that you are practicing safe sex. There are so many different ways out there to prevent STDs and HIV. So practice safe sex. Now, let's talk about staying healthy. There has been so many cases of COVID and the flu and just the common cold lately. So cover your mouth. Cover your mouth when you cough. Cover your mouth when you sneeze. Now, I have talked about don't touch your face to help prevent germs from spreading and help prevent you getting sick, to help protect your immune system. But when you do cough or you sneeze, you do need to cover your face. Grab a tissue, cough into your arm, cover your face with a mask. You are spreading disease of whatever type that you have, a cold, the flu, COVID, pneumonia, when you cough and sneeze, because it's airborne, it's spread through the air. So just be cautious and cover your mouth, cover your nose when you sneeze, and then wash your hands afterwards. Now, it's summertime and the mosquitoes are out, especially if you live in a more humid climate or where there's water around. So mosquitoes can transmit some of the deadliest viruses. And so I want you to use caution when you're out and about in the evening time, especially. Wear protective clothes, have citronella candles around, wear long sleeve shirts and pants if you can. Use an insect repellent. Use something that will help prevent those bites because you don't want to get bitten. Now, let's talk about safety laws, traffic laws. Now, I threw this one in here because overall, for us to be healthy, we need to be following the laws. So there's laws in place for certain reasons. So traffic laws, when the light is red, you're supposed to stop. When the light is green, you go. And these traffic laws have saved many and many of lives if they're followed. What happens if they're not followed is that puts your life at risk. and it puts others' lives at risk. So I highly encourage you to follow the traffic laws, follow the speed signs, because they're there for a reason. They're there to keep you protected and safe. Now let's talk about water and how much water you're drinking. We've talked about the amount of water that you're drinking, that you should be drinking half your body weight in ounces of water a day. Now, if you're trying to lose or gain weight, that number may be different or fluctuate. But make sure that you're drinking safe water. So most areas you can get water that's been filtered or is safe drinking. It's not contaminated. So if you're in an area that has non-potable water, then you want to make sure not to drink that, because that water can contain hepatitis A, it can contain typhoid, polio, it can contain all kinds of diseases that some of these diseases we've eradicated. So drink safe drinking water. Consider the source where it came from and drink that safe drinking water. Now, the next one is, this is going to fall in with your friends, or could go into a field if you need to talk to somebody. But if you're not feeling well, so if you're feeling down or you feel like you have depression, we all go through bouts of depression. We could have lost a loved one. We could have lost something else. We could have been sick and not be able to do our normal day-to-day things. These things can put us in a depressive state. Now, it is best to find somebody to talk to. Is that a friend? Is that a therapist? Find somebody that you can confide in. Find somebody that can assist you along your journey to help you get through that period of time that you're depressed. If it's clinical depression and you need to be on a certain medication or supplement for a period of time, then let's talk about that. And let's talk about what's the best thing for you so that you're not on it for the rest of your life. Depression is a thing not to be messed with. So find somebody to talk to. Now we're into the summertime right now, and it's not as bad as the wintertime. In the wintertime, we have SAD, seasonal affective disorder, or seasonal affective depression. And that happens in the winter months where there's no sunshine. So take that into account. Now, one of my things is when you need an antibiotic. So we've had a lot of cases of pneumonia floating around lately, and pneumonia can be bacterial and can be viral. Now, a lot of the cases that are bacterial do require antibiotics to help them get rid of the bacteria from the system. Now, this bacteria, we take an antibiotic to get rid of it. Now, please, if at any time you are prescribed an antibiotic, please be sure to take it as prescribed. So you need to take it for the duration of the treatment. If you feel better in 3 days and it says to take for 7, please continue to take it for 7. The only reason you should stop it is if you're allergic to it. When you stop it too soon, you are creating the chance for resistance, and then that antibiotic will not work against that bug for you again, or for your loved ones again, or for your friends again, or for other people. So if you are prescribed an antibiotic, take it in its entirety. That will help with the spread of resistance, and those particular drugs will continue to affect those particular bugs. Now, we talked about washing your hands, especially after you cough or sneeze, but good hand hygiene in general. Wash your hands after you go to the restroom. Wash your hands after you come in from the store. You've been out touching other things. Wash your hands. Now, wash your hands properly. If you don't have soap and water, then you can use hand-based alcohol sanitizer. Washing your hands with soap and water. Put the soap on, friction, wash your hands. Sing a song while you wash your hands. Sing happy birthday, sing the ABCs. It should take you 20 to 30 seconds to wash your hands and then rinse your hands. Regular checkups. So the last thing that I want to talk about in our ways to be healthy is to have regular checkups. So routinely, a wellness check. So a wellness check is checking in once a year. I can do that for you. We can talk about what is going on with you. Do you need to go and see a physician or a nurse practitioner or a PA to have a physical assessment? That's a possibility. Do you just need to have your labs reviewed? Do you just need to have your medications reviewed or your supplements reviewed? Have a regular checkup, checking on your body routinely, checking your body for signs of moles. Look at your body on a routine basis. Check to see have things changed. Check your teeth. Get regular checkups for your teeth. Your teeth do so much for your entire body. Your eyes, having regular eye checkups. Having regular physicals. Are you a woman? Do you need a mammogram? Do you need to check for cervical cancer? Do you have a PAP? What is necessary for you to have your regular checkup? There's many different things that we do. So keep those things in mind. I hope I've inspired you today. If you're interested in learning more about whole body health and how ways to stay healthy overall, then please check out www.drmelissabalizan.com/TV. I have a special just for you. A set of questions to ask before starting a medication or supplement, and the chance for you to look at whole body health. Is that the right next step for you? I have enjoyed talking to you tonight, and I look forward to seeing you next time. Remember, you only get one body, so use it wisely to your health and happiness. Take care.